Sex addiction and narcissism. This is an exciting topic because if you're married to either, you feel like you're married to both. So we're going to talk about that, delineate that so that you can know what is what. Okay? Now, there's a comment section there. I want you to hit that. There's also a subscribe button. I want you to click that and subscribe to all of our videos. We're going to come right back and talk about sex addiction and narcissism. Sex addiction and narcissism. Now, before I get into this topic, I have to explain kind of who I am and what I've been doing for the last 30 plus years. I've been treating sex addicts Monday through Friday for over 30 years. I've done more masturbation histories than probably any person on the planet. Okay? And I've been sober for over 34 years. So I know sex addiction, and I'm a psychologist. I know narcissism. Now, I want to walk through this gingerly. So before I talk about sex addiction and narcissism, I want to talk about depression for 1 minute maybe. Someone can be depressed. They're sleeping, they're weight gaining, they feel worthless, they're down. But did you know that someone who has depression, it could be chemically depressed? That's possible. Did you also know that if someone has low testosterone, the symptoms of low testosterone are so similar to depression that you could actually get misdiagnosed and mistreated? And did you also know that your thyroid could be down, and that's why you have all the symptoms of depression, because they're very similar. So here you have a symptom cluster, depression, and it might be depression, okay? It might be a hormone imbalance, it might be a thyroid problem. And so what the doctor needs to do is find out which one you have. Now that's what I do. I find out what type of sex addict they are, 1, 2, 3, 4, 5, 6. There's 6 types, and there's a YouTube thing on that. You can check that out later. Or go to sexaddict.com, it'll give you a test for that. But here's the thing. I have actually given MMPIs, okay, which is a psychological test. It is what we use. Just like if you went to a doctor and they took a blood test, this is a test to test the soul to see what personality disorders actually exist inside of that. Now, here's the issue. Many sex addicts, if you're living with them, you feel like you're living with a narcissist. Why though? Well, because if anyone has an addiction, sex addiction, porn addiction, alcohol, drugs, any addiction, they stop maturing when the addiction becomes active. So that could be 12, 13, 14 years old, generally speaking. Now you have a 14-year-old person, male or female, they're 50 years old maybe, but they're acting like a 14-year-old. Okay? They are self-absorbed. They are immature. They don't have a lot of empathy. They don't understand consequences of their behavior. And you're thinking any 50-year-old should know this stuff. So you go on the internet and you Google and you find narcissism and you find out, wow, they're selfish. Okay, maybe they act a little grandiose, okay? But they don't have empathy. Dr. Weiss, do you know my husband or my wife, they don't care. I go, yeah, no addict cares. You work with heroin addicts? They don't care. You work with gamblers? They don't care. You work with food anorexics who are so skinny they're dying? They don't care. Okay, so all addicts don't care. And I have had this conversation thousands of times, especially with women because they get tied into this diagnosis. But I want to explain to you that it may be narcissism and it may not be. It may be just the result of being a sex addict. All right. With narcissism, you also will have, kind of this, not only lack of empathy, but the willingness to use other people. Well, addicts use people too. They lie to people. They take money from people. They do this. So here's the thing. You have symptom clusters that look very similar. The immaturity of the sex addict, okay, and some of the diagnosis related to narcissism. So how would someone discern the difference? Now, when you're married to someone, you're kind of like right up against the tree, so you can't see the forest. Okay, you're in pain. You've been lied to. You've been used. You've been cheated on maybe. You've been stolen from. And this person has other relationships and they think they're the center of the world. And of course you feel like that's narcissism because you're right there experiencing the pain of someone who's so selfish. But why are they selfish? Is it a hormone problem, a thyroid problem, or a chemical imbalance? Okay, let's find out. So here is what I want you to just hear from me. So for 30 years, I've been treating sex addicts, okay? And most of them show up with some of those characteristics in the very beginning of counseling. Now, I've been doing this for over 30 years. So I've seen men and women grow out of their sex addiction and become very decent souls who have zero symptoms of narcissism. Now, if you're a narcissist and you actually get recovery from sex addiction, you're still going to be a narcissist. Might be a little softer, but you're going to need to have specialized treatment just on the narcissism. So there's two ways to discover this. One is, if someone has a sex addiction and they're getting sober, let's say 6-8 months or so, that's kind of where they start getting more emotional maturity. And between 8 and 12 months is where empathy actually happens. Now, they can use the book Emotional Fitness to expedite that. There's things they can do to expedite their emotional maturity, but empathy is a mature emotion. Okay, try getting empathy from a 13-year-old. Okay, possible, but not the norm. Now, so here, if they're going about a year in recovery and they're empathetic, they're connecting, they're grounded, they're humble, they've been in 12-step groups, they have good relationships, they're honest about their shortcomings, you are not dealing with a narcissist, okay? Now, that's one way, but that takes a whole 8 months or 12 months for you to find that out. And if you're a wife or a husband of this person, that might be a very tough year for you to invest. However, there is a second way. When people fly into my office, they do intensives. With me, 5 days, we do 3 and 5 day intensives. And with my intensives and the others, they can get psychological testing. Now with mine, it's part of the package. I just need someone to have that because I want to know if there's anything under the hood. So I have personally tested hundreds of sex addicts with MMPIs, okay? Which is a psychological test. If you go to get psych testing, that's what they're going to give you, all right? And very few come up as narcissists, actually lower than the general population. So what I would recommend, now if you went on Google and you're convinced that they're a narcissist, here's what I recommend. Of course, you can do intensive, we can do that. But what I recommend is go to your local psychologist who does psychological testing, ask for an MMPI, and have your person that you think is a narcissist get tested. Objective data is way better than going on the internet and looking up a few things, no matter what, and thinking you have that without getting it checked. You know, you can go on the internet and you maybe have the symptoms of gallbladder, but I would probably recommend before you have your gallbladder taken out that you actually have it scanned and see if there's gallstones in there before you just assume that, because you might have symptoms that might be related to something totally different. So the psychological test can help you and the person to have a final decision about that. And there's lie skills in there and they're not going to fool it. Okay, it's been used for many, many, many decades, okay? So you want to get that done, and then you can find out. And then you can adjust maybe how you're thinking. You can say, okay, they are a narcissist, because there are a certain percentage that are. It's very small in the sex addiction world. But all of them will have, most of them I should say, will have some of those characteristics that feel narcissistic to you because you're living with an immature 14-year-old and they can only think about themselves and they can't see the whole system and how their behavior affects you and the kids, and they can't seem to figure that out. They make decisions that make no sense to you, but that a lot of that's impulsivity and immaturity. It's not a disorder. Now, the good news is if you do get it tested and it's not a disorder, that it can soften and change relatively quickly. And if it is a disorder, you want to see someone who can hit that thing really hard and start dealing with one of those characteristics at a time and soften that. So I hope this has been helpful for you, because I've had this conversation many, 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 many times with people who are totally convinced Dr. Weiss, my husband or wife, they're a narcissist, they're antisocial personality disorder, and they go through, they're histrionic, they're borderline. I go, well, they might be, but we're going to test that, and I'm going to let the test tell me what they are, because I've seen so many misdiagnoses by someone going on Google and trying to assess their spouse. You're too close. Now, please subscribe to our channel. We got lots of helpful DVDs on many topics related to this, and we do want you to subscribe. Now, there's a comment box. Please ask your questions there. I honestly want to help you. That's why I'm sitting here. I want to help you. If you're in pain and you're watching this, I want to help you. So write your comments. We'll respond to them as quickly as possible, and hopefully you can take your next step.